Greetings, greetings. So today I'd like to talk to you about a real life patient I had, made a big difference in how I treat and made a big difference in her life. She came in with pain right here. The doctor had x-rays, saw a hairline fracture, and then, hairline fracture is going to take time to get better. She had gotten better within 1 to 2 days, much better as a matter of fact. And it all happened as I start assessing her. Within the first 15 minutes, I found one thing out, actually two things, that I knew the diagnosis was wrong and she was going to get better much quicker. The x-rays, I'm thinking, weren't right.
You questioned the doctor?
Absolutely. Therapist always questions a doctor because sometimes they're not right. They're incredible people. They work very hard, but there's always things that get by.
So Brad, how did you identify that it wasn't a hairline fracture, and how did you actually fix her?
Well, that's a good question. There's three things that brought it all together. Number one, there was no real obvious mechanism of injury. In other words, she didn't fall, she didn't have any trauma to her shoulder, which put a red flag on. Number two, it's not uncommon for the low neck to refer pain to the shoulder, particularly the back of the shoulder. And number three, when I had her do a range of motion technique with her neck, that's all she moved was her neck going back this way. It made the pain worse in the shoulder, and the pain started to move towards the center of her neck. So they call that centralization. That was the key thing, and that also let me know that this is going to get better fast. It's not going to take weeks, and so we proceeded. So yeah, the exercises, we want to get to that, so let's hold on.
So Brad, what does centralization mean?
That's a good point. Let's talk about that for a little bit. It actually comes from Robin McKenzie. He's a therapist. He's actually passed away now, but he started a whole system, and it's actually a worldwide system, and he actually came up with the phenomena of centralization. He didn't invent it, but he kind of categorized it and made it universal. And what it means is if you have pain, in particular in the shoulder, the central part of the body is considered the spine. So if the pain centralizes, it moves towards the center. So in this case, when the head went back of my patient, the pain got worse, and she said, oh, it hurts more here in the spine. That centralization, and when that happens, I'm feeling very good about how to treat it, and it's going to get better quickly. Now, there are some patients that I'll do this, and it doesn't affect the pain at all. And it's like, it's not centralizing. In that case, I'm going to share with you another trip I do. I actually go to Rick Olderman. He's another therapist. He's still alive. He's writing books, and he's very good. And he has a whole system on how to test the muscular and the position of the scapula. Then I go to that. But I'm not going to go to that. I have success here, and I know, and I knew it was going to get well. So let's go to the exercises on how it happened. All right, so here is the protocol to get through this successfully and fast. First of all, in a seated position, Mike is slouched now, which is part of the problem, and that's why his neck is hurting and his shoulder is hurting. So we teach him posture. So Mike, can you scoot your bottom back in the chair, head up, and then bring your head over your shoulder? And now the proper way to do a neck extension is slightly a chin tuck first, and then look back. There we go. And actually, this is true. I'll tell my patients, think of your head as like a dump truck, and you're trying to spill all the contents out to the back of the thing. Because we do want full range of motion. Visualization sometimes help. Come back up. Now, if Mike says, and this is what my patient said, ow, it hurts, it's more towards the center, and it's kind of uncomfortable to do it. Then I'll take a towel and I'll spin it up like this, and it needs to be about this long. A really big towel doesn't work. We just need some support low on the neck while he does the extension. It makes it more comfortable, and it really can be a big benefit, particularly early in the phase. Now, hold on, Mike. You can hold either the towel down here or in here. You're not going to pull as hard as Mike is pulling. Mike is ready to rip his neck off. That's going to make it worse. Just snug is all. Okay, now and I'm going to get this down lower. So the key is, Mike, can you let up on it? You know, he's a weightlifter. He's always trying. Light for him is like strong, you know. So there, if we can get it down here, that always works good. Gentle pressure, Mike, and the chin tuck and back. Doesn't that feel better with the support?
It does, because I actually have some pain in my left scapula.
Oh, good. Let's do it some more. Back. Okay. Now, you're going to do this 10 times. Now, you're going to stop if the pain starts getting worse. If every time you do it, the pain actually feels a little better, your range improves a little bit, and more importantly, if the pain continues to feel like it's in the center of the neck, that's a green light, and that's the system I use with patients. Green light means continue to do it, but stop at 10. Oops, boy, that made a noise, huh, Tanner? Then also, what we're going to do is not do it once a day, but every hour. Okay, that's real key. And of course, monitor your posture while you're sitting all the time. That's a life-changing postural event. Did that come out right? That's, you know what I mean. All right, now, you can, once it gets good with the towel, take your hands, reach behind your neck, and pretend your fingers are the towel. So get down as low as you can, Mike.
I don't have much shoulder
He's got
motion.
way too much muscle here. This sometimes works with Mike. It doesn't work because his hands don't get down. If you can reach way down here with your fingers, some people can do that and then do that. Mike is a big weightlifter and he's just got a lot of bulk. So
Not flexible.
yeah, and so you can use this. You can use a belt. Actually works well because they're thinner as you get better. But eventually, when you get to the point where you can go all the way back, no pain, then you don't have to do it anymore. And that usually will take, if it on a good pain, you know, on a really good situation, 1 to 2 days. In this situation, it was that fast. She was so happy her fractured scapula was no longer fractured. She was living life wonderful again, and that's all. I saw her twice.
You're a miracle worker.
Well, it was Robin McKenzie, and it was very simple. So it's always nice to have a success in the clinic, and I hope that all of you can carry on with the success here. Mike, you said you can put a link down below.
Yeah, so if you are having shoulder pain and this is not helping, we do have a video called 95% of shoulder pain is fixed with these 3 exercises. We'll link down below, and it has a lot of Rick Olderman's protocol. And we'll also link his neck and shoulder program down below. It's all one part. It's called Headaches because it all relates in his systems approach.
That's right. So you've got really good odds of having shoulder and neck pain resolved either this system or going through Rick Olderman's. And there's one important thing.
What?
One thing is they're good. You want to maintain that posture all the time and do chin tucks while you're driving. You can do chin tucks. Yeah, I do them.
While you're
People look
driving?
at me funny at the stoplight. You can put your finger there like Mike does. But while you're at work, if you do work at a computer, then chin tucks, 10 of them every hour or so, become a habit. It reminds you of posture and keeps your neck where it needs to be. Bob and I have talked about chin tucks for the last 13 years on video. All right, good luck with your next shoulder and enjoy your day.
Goodbye.